I would like to acknowledge the traditional custodians of the land on which we meet today, and my respects to the elders past and present. And I extend my respect to the Aboriginal or Torres Strait Islanders people who are present today. I also would like to thank my co-authors, Dr. Kathy O'Callaghan. She's present here today with us. She's a research fellow, Centre for Primary Healthcare and Equity, University of New South Wales. Jane Roy, National Content Manager, Cancer Council Australia. And Francis, she's a cancer survivor, and many others from all over Australia. Patients affected by cancer from culturally and linguistically diverse backgrounds generally have poorer health outcomes than the Australian population. Literature and data informed us. To address these inequities, Cancer Council Australia undertook a project to access the cancer information needs, cultural barriers, and support requirements for Arabic, Chinese, and Vietnamese-speaking communities. This project was funded by Cancer Australia. In-language focus groups and service provider interviews confirmed previous research that fatalistic cultural beliefs, shame, stigma, language barriers, and low health literacy may detrimentally affect help seeking and treatment. Sorry, I forgot to move the slides. So one of the quote that we heard from the focus groups, it's not spread by hugging, shaking hands, sharing toilets, using the same dishes, or kissing someone who has cancer. Some other quotes that I brought it here today to just give you a view that what that means, cultural belief means. The fact is, one of the participants said, the fact is that there is not much information about the background of cancer, why people get cancer, risks, health risks. Some people even to this day believe some sort of bad things they did in the past and now they are getting punished, some sort of karma. Another participant said, it's a problem with our community because firstly they think, if I haven't got these symptoms, why do I have to go for screening? And some of them, they normally think that screening can cause cancer. There's another participant said, there is also stigma in the community towards those with cancer, and people often assume the individual has the worst kind of cancer. Some do not want to seek information or tell others, preferring to keep it in the family. There can be the added fear that it might affect the marriage chances of others in their family, as they believe their children will inherit it. There was another participant said, there is also a notion of among us some that those diagnosed with cancer to accept their fate as part of their religious faith. It's perceived as being part of their destiny to be tolerant about cancer. There was a strong interest in herbal medicines and cures, such as the use of pawpaw leaf juice and aloe vera. This was used either while waiting for Western cancer treatment, in combination with Western treatment, after Western treatment, or instead of Western treatment. So the project was a really big project, just almost 4 years now. We had stages of the project. I'm talking about the final stage of the project. The final stage of the project aimed to develop web-based, culturally appropriate resources for core communities affected by cancer. This would increase their access to cancer prevention information, early detection and support provided through the health sector. It also will help to engage communities from core backgrounds, increases the capacity of the health system to reduce the burden associated with the later stage of the disease and significant health literacy barriers. Providing co-designed in-language web resources in culturally appropriate and accessible ways raises hope, builds health literacy, and enhances support. Communities are empowered to discuss sensitive health issues with their health professionals and participate in prevention and early intervention. So what we did, we produced resources, web-based resources were workshopped and co-designed with targeted communities, health professionals, and cultural experts to ensure key messages were culturally appropriate and resonated with communities. During the focus group, when we asked how to address cultural barriers to accessing information, one of the participants said, well, I guess it's giving them real facts, but also allowing a bit of a hope through the language we use. So we have now 4 in-language fact sheets and 4 videos that support those fact sheets. It gives us clear and concise, key culturally appropriate messages to build health literacy, stories of survivors to bring the key messages to life about cancer survival. We also produced some other resources, posters and postcards that could promote those videos because they are web-based. So we produced that some printed resources that could help communities that easily access to that. One of the postcard that we produced with QR codes is really easy access through your mobile phone cameras to the videos. We also produced that 15, like we had 2 different videos, there's 15 minutes and 5 minutes. So it's the 15 minutes has been shortened to 5 minutes to people who wanted to quickly access those videos. So who participated? As I mentioned in the earlier that it's been co-designed with clients, their carers, community members, community organizations, researchers, consultants, speak bodies, and healthcare providers all over Australia. It raises hope, builds health literacy, enhances support, empowers to discuss sensitive health issues with their health professionals, participate in prevention and early intervention. So we have Frances here to tell you all about her experience with this project.
I'm Frances, cancer survivor for 15 years, and a proud volunteer at Banana Community Center, Cumberland Council. I worked and volunteered at Asian Women at Work and many other organizations before and after my cancer diagnosis. I studied at TAFE to enhance my knowledge to contribute towards to the Australian society. One day in October 2003, I was diagnosed with breast cancer. My family was in tears and heartbroken. The diagnosis hit me hard, but I tried to be calm and listening to my doctor. My parents traveled from China to take care of me. And my son, who was 19 at the time, drove me to doctor's appointment and treatment. They cooked the best food during my treatment. When I started losing my hair of the first time, I shed tears in silence. Then quickly realized cancer cannot cripple love or shatter hope, or cannot destroy confidence. After the treatment, knowing my communities, I realized that my personal knowledge and experience of cancer treatment might help others in my community to overcome shame and stigma or cultural beliefs. I know health professionals and are experts in their field, but their knowledge and experience will be different to the experience of mine, who is used to service or living with cancer. Then someone used me in designing the project or in research. My insights will help making the languages and contents of information provide more culturally appropriate and accessible. For example, in questionnaires and patient participants' information leaflets, helping to ensure that the methods proposals for the project are accessible and sensitive to the situation of potential participants and overcome cultural beliefs. For example, support group in Banana Community Center, my video brought the fact that I'm a cancer survivor and I'm not ashamed about the cancer. This motivates give power to the members of the support group to talk about their own issues. When I lost all my teeth, I lost confidence. I did not want to see people or go out. But fortunately, from Banana Community Center, Gavin said, "We understand you. Your appearance does not matter to us. You belong here." He encouraged me to volunteer. Again, Cancer Council project helped me confidence grow because the video allowed other cancer survivors coming in to get support. The launch of the video brought some light to the other people who have cancer, helping to make sure that outcomes that are important to my community. Increasing community participation in projects like Cancer Council, CLD resource project. I want my people to know when they hear the word cancer, it's not associated with that anymore because they think it is just another word. And such a shame as I did sometimes wrong in my life. When the doctor told me I have cancer, I want to fight against, then I found a way to beat it. So I want to pass this information to my community. I want to tell our communities there is always hope, which I did it through the production of the video, not only to my community, but to the world. I want to say the doctors are working together for the great good for our health and your survivorship. Be honest and open yourself with them. Never miss the appointment. I want to tell all my people, stand up for yourself, ask questions and explanation. Get a second opinion. Ask for an interpreter if you don't speak English. I want to tell, take care of yourself, even when you are healthy and you do not have cancer. It is important to go for regular checkups with your doctors and health screenings. If you are healthy, you can take care of your family. I want to tell the chemotherapy treatment was very uncomfortable, and there has been challenges at times. However, my family, friends, and my inner strength helped me to get through the worst time. So support each other. The strength to cope with these challenges came from my family, friends, Banana Community Center, and the network, especially with my workplace, Asian Women Network. My insights and other community members' insights and opinions were well received in this project. We felt we have been heard. The resources includes every possible idea we suggest to overcome our cultural beliefs and improve health literacy. We suggest fact sheet might not be enough as some people cannot read, so the project team decided to produce a video to support the fact sheet. Then we suggest a shorter version of a fact sheet, and we produce some lovely posters in translation. Our participation in the CLD resource productions develop more comprehensive understanding of the issues related to cultural beliefs affecting accessing to cancer information. We work together with Gaia and the team in every step of the production phase, from choosing appropriate words to the fact sheet, checking the translation, writing up the scripts for the videos, overview them, deciding the image for the postcards, medium of the promotion and launch of the videos. We worked together to implement realistic changes. Hundreds of the conversations and meetings happened to produce these resources. I was amazed by the support and motivation Cancer Council provides through this work. They were amazing, listen to us. Through this experience, I felt motivated and empowered. I would like to express my deep gratitude to all of you who are engaged in cancer research projects and work. You are constantly exploring and innovating in the fields of science. Your work is great, far-reaching. You help millions of patients around the world regain their lives and return to society. We must be grateful to this society. Pass on, share health information, use our ability to reward the community, and help more people in need. To me, cancer survivorship is not about getting through cancer without dying. It is about living through cancer treatment and then finding a way to live your life. Thank you.
So I'm going to finish soon. So that's just one survivor who worked with us throughout the project. And also I just would like to conclude with one statement. Prior to this project's commencement, there were no in-language or translated resources for the community that were specifically co-designed to raise hope, diminish shame and stigma, and build health literacy. The resources are the first of their kind in Australia and has been distributed all over Australia. Co-design activities and those resources have empowered community members to become champions in their communities, like Francis. Thank you.
There's nothing more humbling than listening to a real story, and I really thank you, Francis, for sharing that with us. I have a question that I actually I think about a lot. So in our culture, bush medicine is very, very prominent as a way of us experiencing our culture and our healing. And I'm wondering what you used from a cultural point of view to help you get through your journey.
What kind of traditional medicine? Did you use any traditional medicine?
My father from China, he got some of the description is Chinese traditional medicine. When the first chemo, after 7 days, she cooked the herbs for me to drink, and that's why beating up my white cells every chemo, before the chemo test, a blood test, up to the standard. Yeah, that's what I have it. Yeah, they cook a lot of food to me. Even I swarm I could not swarm the food, but I try to eat the tomato and all the things, because my father cooked me. Even I very hard vomit, I still say I'm okay. Yeah, that's what I do.
Can I comment on that as well? Sorry. The traditional medicines are not only in the Chinese community, it's part of most of the Southeast Asian communities' life. So we can't say not to take. Maybe there should be a lot of negotiation with the health professional, what to take, how to take, what time to take it. So there's a really strong belief around traditional medicines, and it's been practiced legally in the countries where we are coming from. I was reading an article about Mongolia. There's a big ministry working together with, health ministry is working together with the traditional medicine work. So it's really important that health professionals talking to patients about that. Yeah.
Look, I completely agree, and Bryce, I really wanted to bring it up, I suppose, because it is a part of our culture, and we live in a very Western mainstream biomedical model, and I think it's very important for us to push forward our cultural traditions and our rituals as a way of getting ourselves together as well.
I just want to support that comment because I have relatives in Singapore and Malaysia, Indonesia, and in those countries, cancer is treated in the hospital legally, and there is medicine provision for modern Western medicine in conjunction with the Asian traditional Chinese medicine. And for myself personally, when I went on tamoxifen, I had very bad reaction to the medication, but it was my Chinese medicine, herbal medicine, that has stabilized everything, and I'm now 6 years in remission and haven't got any more bad effects from tamoxifen. So I'd just like to share that.
Thank you. This is a wonderful project, and thanks for sharing this information with us. My question to the project coordinator is, using a co-design approach, mostly we talk about building stakeholder consensus. We all talk about the involvement, but it's not an easy approach to do because you are considering several stakeholders and you have to include their information to bring out this innovative strategy. So my question is, can you share with us some of the lessons that you learned during this approach, how you were able to build a better consensus to develop this information for your participants? Thank you.
So this is because it's a long-term project that we are fortunate to have that sort of work together with the communities and many people. The strategies we had from the research, we had a research phase as the second stage of the project. So we included communities and survivors in that phase to hear from them. So that from that it's a built grassrootly. So that from there we took it slowly. So also the Cancer Australia was really, we are fortunate they had that kind of time frame for us to work with them to deliver this project, high quality, resources. I know I had problem, bringing people to the videos that we provide, getting survivor stories for the videos. So I was working for 6 months for one of the particular video to get a survivor. So it's really, you go to the grassroots level connections to work with, religious leaders, community organization, community leaders, cancer survivors, health professionals, local health district, so you have to establish multiple partnerships. We had an advisory committee it's a national advisory committee, who we had members from every state, not only from cancer councils, it's from local health district, from community organization, community groups. So it's a big advisory committee who supported us on this project. Those are the little things that we did. Yeah, I can talk to you later in the year.
So thank you so much for your presentation.